The co-founder of the cryptocurrency Ethereum is focused on data sharing in an open and decentralised manner for the benefit of all. His passion is contributing for social impact and specifically to help prevent another pandemic. Vitalik Buterin gifting the largest known cryptocurrency donation to an Australian institution, sending over $5 million Australian dollars worth to the University of New South Wales. The fund supporting the development and deployment of an open source tool which provides pandemic early warning signals. For more, I'm joined by the developer of EpiWatch, Professor RAINA MACINTYRE, who is the head of the Kirby Institute's biosecurity program at the University of New South Wales. Professor, thank you so much for joining us today. Talk to us a little bit about EpiWatch and how it works.
So EpiWatch is an early warning system that basically harnesses open source data, so information that's out there in vast quantities, whether it be social media or news feeds or other, open source data. It harnesses that data using artificial intelligence, so a series of algorithms, to generate signals or early warnings of potentially serious epidemics. Now, if something like that had been present that could have picked up the COVID pandemic, for example, before it had spread outside of China, then, COVID would have been like SARS-1, something that was, brief, but then relegated to the archives of history. But instead, it spread rapidly around the world. Generally, the way we pick up epidemics is through traditional health surveillance, which relies on health systems, doctors, or laboratories notifying diseases, and that has a bit of a time delay to it. So we're trying to get the signals earlier than that, which can then prompt an investigation and earlier diagnosis to pick up epidemics right at their genesis, because epidemics grow exponentially. It's, this is why we've seen supply chains collapse and hospital systems collapse, because things can change in a matter of days or weeks. You can go from business as usual to severe workforce absences and health systems overload. So you don't have a lot of time. You've got to act very quickly, which is why the early detection really matters.
Can you paint the picture for us of how this would have worked if it had been in place in Wuhan?
So if it had been in place, we might have seen a signal for severe pneumonia of unknown cause sometime earlier than December the 31st, which was the date that it was officially notified to WHO. And that meant that the whole world would have had earlier warning and may have been able to prevent the pandemic from seeding in multiple different countries and spreading.
Does it replace the formal reporting mechanism, or do you see it replacing the formal reporting mechanism that we have at the moment?
No, not at all. Formal reporting is still essential. It's an essential part of surveillance, but it's not timely. What this does is provide an earlier kickstart to the whole process of investigating and mitigating epidemics. So instead of waiting maybe a few weeks or a month or 2 months maybe before the notifications land on the desk of someone in the health department, you're getting a signal from the very source, from the village, for example, where the epidemic might be starting based on what local news agencies are reporting, long before it becomes known to health authorities.
So to use the China example, for example, you might have had news reports or data from inside, from doctors or from hospitals that would have indicated that there is something out there that, doctors at the time weren't familiar with.
That's right. And when you're looking for an unknown disease, you look for clinical syndromes, and there's a limited range of different clinical syndromes that a new infection might present with, and it basically relates to different organs in the body. It could be pneumonia. It could be something to do with the brain, like encephalitis, or something to do with the nervous system, like paralysis. It could be gastrointestinal, like vomiting, diarrhea, nausea. It could be rash and fever. It could be hemorrhage, like something like Ebola. So the system, EpiWatch, also searches for syndromes so that we can pick up clinical syndromes of diseases that have not yet been diagnosed.
What is the timeline, Professor? You know, where are you at the moment, and talking about where you hope to be with the various languages and so forth, and the distribution of the tool? What's the timeline for getting it out there globally?
So I think in terms of the what we're calling the Shiba Inu OSINT initiative, which is the project funded by Vitalik Buterin, it's probably we'd like to get the objectives of that met in the next 2 years. But there's a bigger 5-year plan to really expand the global footprint of EpiWatch, and also to build capacity in public health workforce for utilizing digital technology. The interesting thing is that AI is used very widely in clinical medicine, but public health is still quite old-fashioned. The way we do surveillance in public health, which is disease detection, is quite old-fashioned. So we want to also work in training and capacity building through field epidemiology programs around the world to develop a new generation of digitally literate public health workforce.